Good morning, everyone. I'd first of all just like to thank you for inviting me along this morning to meet with you and to chat to you. I've been attending Soft Scotland Family Days for many years, initially in my previous life as a midwife working in fetal medicine in Glasgow. And over the past 9 years now, can't believe it's 9 years, I've been working as the Scottish coordinator for Antenatal Results Choices. I get the grand title of Scottish coordinator because I'm actually the only member of staff in Scotland. So I can basically call myself anything I want to. And there's no clock in the room, and I can talk forever. So if you need me to stop, you just tell me to stop. So just for those of you that are not aware of ARC, just a bit of background information. ARC actually started in Scotland as a group called CARE. And CARE was set up by parents who had been given the information that their baby had an anomaly or a genetic condition. Some of whom found that the support that they were given was very good, but many found the support that they were given was not as good as it should be. So a group of parents got together initially and set up CARE to provide information and peer support for parents having to make difficult decisions during pregnancy. And they also produced information for health professionals to try and improve the care and support that was given to parents. At the same time, down south was a group called SATFA providing similar support, and they joined together in 1998 to become ARC. And ARC provide support for parents, and I'll use the terminology women and our partner and parents because that's the terminology that the majority of people use when they contact ARC. But we provide support and information to women and their partners who are having to make decisions before, during and as a result of antenatal screening. We support parents who are having to make decisions around the results of screening tests. We support parents when a fetal anomaly or genetic condition is diagnosed in their baby and having to make decisions around that, and having to make decisions about the future of the pregnancy. And we support parents who are dealing with the consequences of those decisions. And at ARC, we support parents whatever decision they make. But for those who decide to continue with their pregnancy, then we will do our best to signpost to organisations like SOF, Down Syndrome Scotland, who can give that very specific support, as you know, around the condition that the baby has. So the majority of parents that we provide continued support for are those who make that very difficult decision to end their pregnancy following a diagnosis. And that's why it's so important that we work together, because whatever decisions parents make is obviously very individual to them, and that decision needs to be supported and respected. But we need to work together to make sure that the support given to parents is appropriate and as good as it possibly can be. And this is just to give you an idea of, and sorry, I realise I'm standing in front of the screen for some, the type of contact that we get at ARC. So you'll see that actually just under about 50% of the people who contact us are having to make difficult decisions around screening. And sometimes that's even, should I have that screening test, because it's not right for some parents. But having to make decisions around the result that's been given, and you can see that just over 50% of the parents who contact us are parents who have been given the information that the baby has an anomaly or genetic condition, and who may be bereaved as a result of having to make decisions around that. So it's really an update of what I've been doing with ARC in Scotland, and one of the things that I've been involved with over the past few years is information that's given to parents around screening. And you may be aware that screening has changed over the past couple of years, and now in Scotland since 2020, all women who attend for antenatal care will be given the option of screening for Down syndrome, for Edwards and for Patau's syndrome. And so parents have to make the decision initially whether they want that screening or not. And for many parents, that straight arrow is, it's very straightforward. Either, yes, I want as much information as I can possibly get to allow me to make decisions around that. But for some parents, it's no, I would not wish that information at all. And it's really important that for parents who make that decision, that is supported and respected, because screening is not for everybody. But I would say that for the majority of parents, those two crosses are not there, and it's actually a very difficult decision as to whether to have screening or not, because in many cases that screening test will be reassuring, but for those where it's not reassuring and difficult decisions have to be made around that, then it's important that information and support is there for parents. So so ARC have been very involved in the education and communication around the new screening tests in Scotland, so that parents can make an informed choice. You may be aware that, again, since 2020, for women who have a higher chance screening result, then there's the option of the NIPT screening test, which is only offered through the routine antenatal care service after the initial screening test. So women are offered screening. If that gives a higher chance result, they have the option of the NIPT test, which is another blood test, which is a far more sensitive screening test and is far more accurate in telling whether a baby is likely or unlikely to have Down syndrome, Edwards syndrome or Patau's syndrome. And the benefits of that is that it's a blood test that doesn't carry any risk to the pregnancy, but it's still only a screening test, so it's not 100% certain. But it's very useful for those parents who feel that they would not make the decision to end their pregnancy but want better information. So it's a far more sensitive screening test, and it's as I say, introduced in Scotland in 2020. And will be evaluated. But in fact, Wales have been using it for far longer, and they have already done a 3-year evaluation. And in fact, in Wales, it's been shown that the majority of women will opt for NIPT testing initially rather than going directly to testing such as amniocentesis or CVS. So it's shown that in fact it's the option that most women will choose. The benefit to that is because there's no risk of the blood test, that in fact the amount of amniocentesis testing being performed has reduced significantly, and in Wales it's reduced 9-fold, which means there are far less women having a test that carries the risk of miscarriage. They're gaining their information through the NIPT test. And there's always a lot of controversy around screening and what that might lead to. But in fact, Wales has shown that there hasn't been a change, any dramatic change in the amount of women making the decision to end their pregnancy. And in fact, I think what might happen is that there'll be a lot of parents who use that test just to give them further information. Whereas the only way to get that previously was to have the amniocentesis test. So it'll be interesting to see what happens in Scotland, but I think it's probably going to follow what the Welsh study has shown. You'll be aware that every woman who attends for antenatal care is offered a scan. They're offered a scan initially in early pregnancy, and then they're offered the 20-week scan. And we know that 20-week scan is often when parents are given the information that there is something in that scan that indicates that the baby may have a genetic condition, and they'll be offered further testing as a result of that. But in fact, women often don't see scanning as a screening test. Scanning is a very positive thing, that you go along, you get to see your baby, you get information about your baby, you get lots of photographs of your baby. But for those who are given the information that there is something untoward in that scan, then that obviously is absolutely devastating. So a lot of what I do in Scotland is being involved in working groups and be involved in teaching of health professionals to ensure that the information that parents are given about scanning is that they are made aware that scanning is a screening test and that the support around that is as good as it possibly can be. Now, we know that the majority of women who have screening and who come for a scan will be reassured. They'll be given a low chance screening result and they will be reassured that on scan that everything looks as it should be. But for those parents who are told that there's something untoward in that scan, then decisions have to be made around that. And that can be really difficult for those parents who have said, I don't want any of those tests, I wouldn't want to know, I wouldn't want to have to make any decision. And suddenly they appear for the scan and that information is there and there's no going back from that. So once that information is given, if the baby has a condition that is a severe condition, then they will be given the option of ending their pregnancy. So, you know, entering into pregnancy saying, no, I wouldn't want to have to do that, they suddenly find themselves in that situation. And at ARC, we produce booklets that can be given to parents at that time, a booklet around, you know, those parents who are considering the option of ending a pregnancy, or those parents who are considering continuing with their pregnancy, just to give them some support and some information at that time, and obviously signposting to organisations like yourselves that can give further support to parents having to make those very difficult decisions. Now, we know that some parents will make the decision to continue with their pregnancy, and that's obviously, things have changed. It's a very different pregnancy, and it's about working with health professionals to ensure that the support and information that parents need during that time is put in place for them. And at present in Scotland, there's no standard pathway of care for parents who are continuing with their pregnancy and need that additional information and support. And certainly ARC in England are working with health services to try and introduce a pathway of care that's standard care, so each parent receives the same standard of care, and hopefully that will follow through in Scotland too. Because I think sometimes what happens is that the mother's forgotten about, the focus is on the baby and what's happening with the baby and what's, you know, where delivery is going to take place and, you know, where the baby will be after delivery. And the mother's actually forgotten about, you know, and during later on in pregnancy, you know, women do have issues like, you know, heartburn, hemorrhoids, you know, all the things that cause some distress and discomfort, but often parents feel that that's not important anymore because it's about the baby and everything needs to be about the baby. So it's working with health professionals to ensure that that holistic care is put in place and that we remember that there is a baby, but there's also a mother who might be having some physical discomfort along with all the emotional, you know, turmoil that's going on. So as I say, working with health professionals to try and ensure that appropriate support is put in place for everyone. And not just the mother, of course, but partners too. I've been really fortunate to be involved in the introduction of the National Bereavement Care Pathways in Scotland. I don't know if you're familiar with these pathways, but they are standards of care for any parent who is bereaved following the loss of their baby. And there's 5 pathways. There is a miscarriage, molar and ectopic pregnancy pathway. There is a stillbirth pathway. There is a neonatal death pathway, and there is a sudden infant death pathway. And there is a termination of pregnancy for fetal anomaly and genetic condition. The name of the pathway needs to change, and we're looking at that and we're working on that. But these pathways are standards of care that health professionals can work with. And in fact, in Scotland, every health board in Scotland has to take these pathways on board. In England, it's not the same. Trusts can decide whether they want to work with the pathways. In Scotland, it has become the practice that all health boards have to work with these pathways. Some health boards are very good at providing bereavement support when a baby is lost, and others are not so good. So the pathways are for health professionals to work with to ensure that the standard of care that's given to every parent who loses their baby for whatever reason is the same. And these pathways have been led by parents. It's the voice, and you know, you were saying earlier about how important it is to hear the voice of parents. And that's what health professionals listen to. It is so powerful. So the standards have been put in place, listening to parents, what parents found supportive, what was lacking in their care and support, to try and ensure that every parent in Scotland who loses their baby is given the same standard of bereavement care across the country. And we launched the pathways in March this year, and there was a big meeting in Edinburgh. But parents came along to that to talk about their loss within each of the pathways, and the feedback from the meeting is that that's what health professionals took away. That was the most powerful voice that was heard across the day, was the experience of the parents. So I think it's really important, as you were saying earlier, that that's what health professionals hear, because it's what they listen to. It's not somebody standing up from a university or a college, you know, talking about a condition. It's the experience of parents. It's the, you know, the voice of the parents that health professionals really need to hear, and in fact health professionals really want to hear, because it helps them improve their care and support. So, as I say, I've been very fortunate in being involved in the pathways to try and get those bereavement standards out there and improve the standard of care that's given to parents. We also are aware that sometimes when an anomaly, a genetic condition, is diagnosed in a baby, that might be in a multiple pregnancy, either a twin or triplet pregnancy. So we've been working with the Twins Trust to try and improve the information and support that's available for parents who have a multiple pregnancy, to improve the communication between different hospitals, because they may need to go to a different unit. So working with the Twins Trust to produce information for parents that are given that information, have to make decisions around it, and also for those parents who are bereaved and have a multiple pregnancy, so that those bereavement standards of care are there for parents who have a multiple pregnancy, where sometimes maybe all babies may be lost, or there may be, you know, the live birth of a baby, but the loss of the twin or triplet. So what do we do at ARC to support parents? So for those of you that know us, we're a very, very small charity. You know, most of my colleagues are based in London. We now have a coordinator for Wales, and we have a coordinator in Northern Ireland. But most of my colleagues are based in London, and we provide listening support. It's not counselling it's listening support for parents having to make these difficult decisions, and we do that on our helpline. We do that with our online forum. We have our website, which also has recently been updated too. We provide our booklets that I've mentioned, but not only do we provide booklets for parents when having to make that decision, we provide booklets for grandparents, for, you know, talking to children, for more vulnerable groups. I do a lot of professional training, and that's talking to health professionals to try and help them understand the importance of appropriate care, appropriate support, and supporting and respecting the decisions that parents make. We provide trained peer support, as I know you do at SOFT, and as you've heard, kind of very involved in policy and research, and that's putting across the voice of the parents within these groups. So when Scotland's introducing, new screening tests, when they're introducing bereavement care pathways, it's to ensure that the voice of the parent is on those working groups, and that's my role within those working groups, is to be an advocate for those parents who find themselves in that situation. Also in Scotland, as I say, we support parents whatever decision is made, but those who continue with the pregnancy, we will do our very best to signpost to more specific groups that can give that specific support. For those parents that make the decision to end their pregnancy, sometimes those parents find it very difficult to access baby loss support groups, because how do you go along to a baby loss support group and be with parents who would say, I would do anything, absolutely anything to have my baby with me, to then declare that in fact they have made the decision to end their pregnancy because of the condition that was found in their baby. So sometimes parents go along to these groups and they'll disclose that they're bereaved but not disclose why. Or sometimes they just don't go because of the fear of being judged because of the decision they make. So working with a group called Held in Our Hearts in the Lothians area, and working with SANS and Child Bereavement UK in the Glasgow area, we have set up peer support groups for parents who have made that decision, and they can come along to that meeting and talk to other parents, knowing that those parents will have made the same decision, and that's why they're bereaved. So we hold those every few months, one in Lothians and one in Glasgow. Just a few of the booklets that we provide, as I say, for parents, very similar to other baby loss support groups, but coming very much from having had to make that difficult decision. And as the support groups that I've mentioned, as I say, working with one in Glasgow and one in Edinburgh, so that parents know. And parents worry about coming along to these groups because they worry about who else might be there, who might not understand that difficult decision that they've made. So unlike groups, other baby loss groups, we cannot advertise these groups. Therefore, we're reliant on health professionals giving the information to parents so that they know that that's a safe space for them to come along and talk about all aspects of their loss. ARC's tiny, I know SOF's pretty small too. It's about working with other support groups to ensure that the support that's given to individuals is as good as it possibly can be and is appropriate to their situation. And therefore, it's about working together, and it's about signposting. I think we've thankfully moved on from the days of support groups being very territorial about the support that they give and the area that they give it within. So it's about working with other groups so that the care and support is the best it can be for the individual that's looking for that support. And support groups are not for everybody. We know that. It's not about pushing it down people's throats. But the worst possible scenario is parents who are looking for support and they don't know how to access that support. And the way to improve that is for us, all of us, to work together to make sure that's as good as it possibly can be. So thank you very much for listening. I'm happy to answer any questions that you might have.
Why did you say the National Bereavement Care Pathways come in Scotland?
But they were, oh sorry, I didn't mention that. So they came, I'll go back actually, they were introduced, we started working on them many, many years ago, and then COVID happened, yeah.
I can remember starting work on them, that was 5-6 years ago.
Yes, and we were just about to launch them in March 2020. Something happened. So they were launched in February, I think, this year. But initially, 4 health boards took them on board, the ones at the top, working with them, and then the others at the bottom joined this year. And by the end of 2023, all health boards in Scotland should be working with the pathways. And the pathway, as I say, the standards of care, I haven't put them all up, but it's like having a bereavement lead in each hospital, so somebody takes responsibility for that. It's not that they have to do it all themselves, but they coordinate the care and the support care within their hospital. It's about having appropriate rooms to look after parents when they come into hospital. It's about training for health professionals. It's about listening to the parents' voices, about, as I say, what they find supportive and helpful, not what health professionals think are supportive and helpful. And as I say, the voices of parents has been a huge part of that. And as I say, on that study day, all the feedback come back is about how powerful the voice of parents is within that.
So all these guys are all involved with this?
Yes, every health board in Scotland will have has somebody within their health board that are ensuring that the pathways are embedded into their health board, so that, you know, yes, so that, and I mean, some hospitals do it really, really well, but others do not. So it's, and I think sometimes health professionals think, well, we're doing that, and that's great, because what they're doing, they then know is what parents need and parents want. Some health boards are not, so it's to bring, you know, that up to
like a standard into.
Yeah, there's been a huge, so it's been amazing actually since they were introduced. So there's a lot of the hospitals didn't have appropriate space within their so it was a labour room, you know, a room and labour ward that was used. But in fact, so many hospitals are now, you know, doing up that room so that it's far more comfortable, it's far less clinical, that it's soundproofed, which is really, and that came across from parents, you know, that was really strong about being in an area where you could hear other things going on. Yep.
They work, you guys see the pathways. One of the things that has come up is how parents are given difficult news. Is that something that they're covering?
Well, yes. So yes, it is, and it's covered in all the pathways. As I say, I've been very involved in the TOPFA pathway, and in England, I use TOPFA just because it's easier to say that. So the TOPFA pathway in England starts at the time where the woman goes into hospital. In Scotland, I had to fight very hard, but was six to take it back to when parents had given that initial information, either as the result of a screening test and having to make decisions around that, or the result of a scan or testing, because we know that the communication and the information given from that point will have a huge impact on parents, either if they decide to end their pregnancy or the baby dies as a result of having that condition. So in fact, the pathway in Scotland starts at the time of diagnosis of the condition, and the importance of appropriate information, support and communication while parents are having to make that decision. And that's the difference of the pathway in Scotland to England.
And is that going to eventually filter through to England? Do you think that will have the same?
I don't think they're going to. They might not change the pathway. However, again, there's been, and I notice a huge difference. I've been involved in this over many years, but in fact, there's a set of guidelines now for sonographers, because quite often that's, you know, it's sonographers who are giving that initial piece of information. And sonographers did in Scotland, because I've been doing that for years, but they didn't in England. So they've produced a document that, again, sonographers can relate to, and it's about communication. And there's been a big increase in the amount of training that's available for sonographers, because sonographers feel very vulnerable. I mean, they're not, you know, having to give that news is difficult. You know, it's not as difficult as receiving it, and I appreciate that. But sonographers they get no training. They're really worried about how to do that appropriately. So there's been a big increase. Scotland have always been good at doing it. I've been doing it for years, but in England there definitely is a big push to provide that.